Good afternoon, everyone. It's me, Dan Harrison, and I'm here today. It is September 15th. This is our weekly town hall. Um, this is the day that we dedicate each week to reviewing some of the facts of the data, talking about business at hand, things that people need to know. I think this is as good as any time to for all NuPath staff to remind them that we are working up against a deadline to have all staff connected to our residential programs tested for COVID. We've been talking about this now for a number of weeks, so this should come as no surprise. And if you're a staff person that has been living under a rock or doesn't know anybody that works at NuPath or does not check their email, then this may be news to you. But this is serious, guys. We still have over 100 employees, Karen tells me, that we're still waiting on tests for. And we've got a couple more days yet, but this is something you don't want to put off any longer. And here's the deal. If the deadline comes and you have not been tested with proof to our Human Resources Department, you will be suspended without pay. It's that simple. We cannot have you working within our programs until this test is done and until the results are in hand. So if you're going to wait till the day before a shift and you don't have the results, you will not be able to work. So this is not something you want to put off anymore. We made it pretty straightforward for folks, and it should be fairly easy to accomplish. So I'm urging you all to make it a priority, please. And for all of those who have done so already, thank you. Thank you very much for taking care of that. This is something that's just another one of those necessities that has been foisted upon us from this pandemic. It's not something we ever would have thought we needed to do before, but these are different times. Related to that, we have our flu shot clinic here tomorrow. If you haven't yet reserved a space, please email Sharon Pitts or follow the directions on the email that went out to people. There is a form that should be filled out. Our insurance company will cover it, so there will be no charge to you. And I've been told that we'll be getting these in our car, so we'll be somehow lining up, or I'm sure that it'll be very clear when you get here how to manage it. I don't have all those details, but if you ever have gotten the flu shot in the past, this is the year you definitely want to get it again. And if you have not gotten it in the past, this is the year you may want to consider doing it for the first time, because it's just one thing that you don't want to get while we're still dealing with this pandemic going into the fall. So I sent out a video on Monday about a little trip that I went on to Shelburne Falls, Massachusetts this weekend. For those of you who have never been there, I highly recommend it. It is located just off of Route 2 up in the northwest part of the state. I think I have a couple of slides that are screenshots from my trip. And this is a spot that I've been going to with John, my husband, for many years. I bet 2 decades. And we took a drive up there because it's just a nice place to go. There's a wonderful little cafe, the Bridge Street Cafe. And I filmed some video of at least one video there before in the past. So I'm just waiting for maybe I don't see it because I'm on full screen. Is that it? No. There it is. Oh no, we're gonna do the article first. Sorry, my bad. Yep. Thank you, Greg. So before we do that, I wanted to share with you an article that was on 538 online, and it was titled, "Why Coming Up with Effective Interventions to Address COVID-19 is So Hard." In this article, it says, convincing people to wear masks sounds like it should be easy to fix, but understanding why they're not wearing masks in the first place is pretty complicated. And there's three reasons that they point to. Number one, it's about risk perception. And this is that some people don't believe that it's that risky to get COVID-19, or that it won't be that much of a problem. Second reason is perceived efficacy, that people think that wearing masks won't actually reduce their risk. There was some confusion at the beginning of this pandemic as to whether or not masks did anything to help to curtail the spread, but we know that to be information that has changed. And the third reason is that it's a norm perception, that people don't think anyone else is wearing their masks, and so if you're not wearing your, so you feel like, what's the point of me wearing one? I can still remember the first time I went into the Stop and Shop in my neighborhood wearing a mask, and it was before everybody was, and I felt weird. I felt awkward because I felt people were looking at me and maybe looking at me funny, like, what's his problem? But it was within a matter of days that Woburn adopted a citywide ordinance that required the wearing of some sort of face covering when you were in any kind of a place of business. And now, if you're not wearing a mask, you would be the one that would be considered to be problematic. And in fact, I've gotten as far as getting up to the door of an establishment and realized I didn't have my mask, and all of a sudden felt like totally naked, like, oh my God, like, to get back. And that's how much I think our norms have shifted. At least here in the Northeast, there are other places in the country where wearing masks is still something that people are fighting. And the reason I'm talking about it a little bit more today is because we know for a fact that it helps to reduce the spread. And there are so many studies that are pointing to why this has been an effective model. There have been a decrease in all kinds of other communicated diseases. That's okay, Greg, you can move on. And it's related to the fact that we've been social distancing. So back to my little excursion. So went to the Bridge of Flowers. There's me wearing my mask. It's a new one, I like it very much. And this is a lovely spot. There's an aerial view of the bridge. It's a place that if you've never gone to, I recommend it. And so it could be a nice little destination. And when we arrived, we got to the entrance to the bridge to walk along, and this is what we found. And I talked about this in my video, but for some of you who didn't have a chance to see it, it was said it was closed for the season, and immediately I was like, what? And I was all upset. And then I looked at the sign right next to it. Why is the bridge closed? And the reason I share this is because I think it's a very good example of messaging around this. Because obviously you say, well, why could they have this open? And this is what it said: to keep all of us safe and healthy. The bridge attracts large groups of people at all hours. It's true. It's generally open all the time. The path is too narrow to allow physical distancing. Again, this is true. It's a narrow path. And there's really no way that you could pass anybody coming the other direction and still maintain a distance. Wearing face masks is mandated, yes, but it can be monitored, meaning that some people may not be wearing their masks, and there is no sort of way to police that. There's no monitor. There's no, admissions or tour guide that would ensure that people were actually wearing their masks. And all of this also is to protect the health of the gardeners that volunteer their time and tend to this gorgeous little beautiful little landmark in Western Mass. And I wanted to share that because I thought, number one, it's just a good reminder as to why masks continue to be important. And at a time when we see we've become, I would say, complacent, but I fear that we may be getting a bit more relaxed about how we handle different measures of social distancing. Greg, I can't see myself, but we still broadcasting?
We sure are.
We sure are. Okay. I don't know where it went, but so So social distancing and all the things that we have been doing has brought us to a point where we are below a 1.0 positivity rate. We're not going to look at the data. We're not looking at as closely at the data today. We're going to take a little break from that. But I was going to share another personal story. So last night I went into the market basket in my neighborhood, and this is where I've been pretty much shopping for the past year or so since I moved to Woburn. And the floors are clearly marked one way, up and down aisles. And every time I'd been there before, I found pretty much universal cooperation. It's a little bit of a pain, but if you're alert, you know, you go down to the next aisle, go down, back. God knows I can use the exercise. So I wasn't thinking too much about it. But last night when I got there, I noticed a marked shift in the number of people that were apparently just full disregard of going the correct direction. Now, this was put into place early on in the pandemic. People will probably remember. And it's designed so that people don't come in as much direct contact face to face as they're passing one another in the aisles. And just as the Bridge of Flowers doesn't allow for that kind of social distancing because of its narrow spread, most grocery aisles do not allow for it either. And after about the sixth or seventh person that barreled past me going the wrong direction, I couldn't help myself. And I don't know, maybe I was a bit of a jerk, but I don't think I was, but I went to the customer service and I asked, I said, so what's the deal on the social distancing? Are we no longer worrying about going in the correct direction? And the poor woman, she looked so exasperated. She's like, oh, not another customer. And she said, sir, we're doing the best we can, but we can't enforce it. And I said, okay, I'm not, this isn't necessarily a complaint, but I just wanted to know if this was something that we're kind of throwing out the window, which I hope we're not. But if we are, I'd like to know it so I don't, I'm not the one jerk that is still insisting that I go down the directions of the aisles of the correct way. And I know I'm not the only person that still does that, because my friend Mr. Bill Yates, who's probably watching right now, who we're meeting right after this, he is no surprise. Anybody knows Bill knows that he abides by rules religiously, and I'm sure Bill is still doing it, going in the right direction. The woman also told me that they're doing the best they can, that somebody had come in earlier in the day that had not been wearing a mask. When the manager had spoken to that person, there was a big public scene that evolved. These good habits, our adherence collectively as a culture, as citizens of the Commonwealth of Massachusetts, all of these things have brought us to the point that we are now, where we have been able to reopen many areas of commerce and business. It has brought us to the point where we are now reopening our day programs, that we're in the process of firing up our transportation department again, bringing drivers back to work, providing resource to families in order to get their sons and daughters into our programs. All of this is because we are where we are now. I'll say it again. And all that we have done collectively has brought us to this point. And it is just a fact that as we begin to cast away some of these practices that in the beginning, when we were terrified and we didn't know what was ahead of us, that we would so carefully adhered to, as these things begin to dissolve and we're not you know, adhering to them collectively, we will see the cases of community spread increase. It's just the way things are, that this is a extremely contagious virus that is waiting very patiently for us to let down our guards. And until we have a vaccine, we are only as good as our ability to stick to the rules that every person should know by now. And I know, because I've worked with organizations and been in leadership positions in many organizations that the surest way to see a custom or a business practice dissolve or disappear is to no longer pay attention to it. And in places and communities where there is general disregard for some of these social distancing in areas of the country where people still believe that this is some sort of a hoax or something that has been made up by one political party or another. These are communities that are going to be seeing an increase. NuPath is not one of these communities. I'll say it again. We will continue at NuPath to abide by every social distancing protocol, guidance, ordinance, practice that has been issued to us, that has been published by the CDC or by the Commonwealth of Massachusetts. The practices that we have put in place around wearing masks, around using hand sanitizers, around social distancing, going down hallways in one direction or another, will not be relaxed at NuPath. And if you're an employee of this organization, I can't compel you to do anything. Well, I can compel you, but I can't force you to do these things when you're home or away from NuPath. But I can insist that this is a practice that will be followed to the absolute letter of the law, because we have too much to lose if we see an increase here at NuPath. And we owe it to our families, to our clients, and I owe it to all employees of this organization to do anything and everything possible to ensure that we have the maximum advantage and the maximum opportunities to remain safe through this pandemic. We've said it again and again that our ability to continue to be open and to see more and more of our folks return into some normal rhythm is going to be contingent upon our ability to control the spread. And so far, we've been doing a great job. And if you're one of those people, whether you're family, client, staff person that's helped us to do that, thank you. Thank you and congratulations, because according to Karen Franklin, we have had only one positive case of COVID in all the tests of all the staff that have currently have gone through with it. And the other 100 that are remaining, we hope we'll see less than one. I mean, finding one and 100 plus tests that we're talking about is about consistent with where we are in Massachusetts. Now, if we had had 5 positive or 10, or even at one point Massachusetts I think was way up there. It might have been in the 20s or 30s. Might have meant that we would have had 20 positive cases. We didn't. We've had 1, and that's where we want to keep it, because that's how we are going to continue to do business in this new landscape, and this is how we're going to continue to open and to return to business. Not as usual. It'll be a while before we're there, but certainly back to providing more access to many more people. So there, I think I've said it enough. If you're a staff person, I don't want to hear that Navigating Life is picking up pictures of people not wearing masks. If you are having a hard time finding a comfortable one, talk to me, because I really like this one, and plus it's kind of stylish. I put it on wrong, I know. I should have done that in front of everybody. But there you have it. Greg, do we have any questions before we end this a little early today?
No, Dan, just
oh, we have the video. We have the video.
Yeah.
That's right. Just as before we close, Greg actually found this video, and I think it's great. This is an experiment that was conducted by, was it the National Health Institute? I'm trying to remember.
Yeah, National Institute of Health.
Institute of Health, thank you. And this is a demonstration to show how the aerosol, or the transmission of this particular virus, the spread of it through the air, is effective with masks and without masks. So if you have any question whether or not masks help, just let's watch this real quick video before we wrap up today.
Stay healthy.
Great,
Stay healthy.
great. Less loud.
Stay healthy. Stay healthy.
Louder,
Stay healthy.
louder.
Stay healthy.
So that showed the first part of that was without masks. You could see the little particles of the black light that were reflecting the droplets that were in the air. The second was with a mask, virtually no sign of that that came through the mask. The other thing to remember about wearing masks, guys, is that they're not all the same. The thing that I remembered hearing that I've been trying, if you have your mask on, you should not be able to blow out a candle or a lighter or a match or something. If you can, it's not effective. And I know that it makes it hot. I'm a hot guy that sweats a lot, and I don't like wearing them. It's uncomfortable. They fog up my glasses, and it is very uncomfortable, to be sure. But we know that they're important, and I know that I can count on people at NuPath to abide by the. And Ted Horn has just texted me saying he has 30 variety of masks they could check out if you've not found one that works for you. But if you're not wearing it all the time when you're out and about, you need to be. Please. We're going to continue to talk about this. This is an organization, as I said, that is going to follow the science, and we are going to insist that our employees wear them when working with our clients and families. We have that responsibility, and we will be a culture, an organizational culture that continues to follow and adhere to these things until we hear that they are no longer necessary. All right, this is not a place where they're going to be ignored or where science is going to be disavowed. All right, Greg, any questions? Then thank you for finding that video for us, Greg, and for sharing that. And anything
Yeah,
that
no questions, Dan, just some positive feedback I'll share with you later.
all positive feedback. Appreciate that. And I'm not going to say what, but of course we're going to have an excellent Unity Forum on Thursday, so you'll want to make sure you tune back in. And for all of you that have eyes on this right now, thank you so much for continuing to stay involved, to continue to care about what is happening in this organization. There's going to be a lot happening as we move into the fall, and you'll want to make sure that you're keeping this channel clear for more information to come your way. So thanks, guys, and I will talk to you soon. We got this. Wear your mask, all that stuff. We just talked about it. Don't make me come and lecture you more. All right, thanks. Bye.